A new level in the fight to stop COVID 19 as Governor Abbott orders Texans to stay home.
Now, I know this is a great sacrifice, but we must respond to this challenge with strength and with resolve.
The order comes as the disease spreads exponentially in Texas and as frustration grows with people who won't follow social distancing rules.
Quit being it. That's my message. Candidly. Get over yourselves.
As doctors brace for a surge of patients, there's urgency to find more protective gear. We'll get a progress report from a key member of the strike force in charge of getting those supplies. Hello, and thank you for joining us for a special edition of State of Texas. I'm Josh Hinkle, and today I join you from the Bob Bullock Texas State History Museum here in downtown Austin, where, as you can see, everything is closed. It's shut down, no crowds, all part of the mandatory restrictions put in place to ward off the coronavirus. And this week in Texas, those restrictions got a little more strict. Governor Greg Abbott issued an executive order requiring all Texans to stay at home except to provide essential services or do essential things like going to the grocery store. But there are exceptions for things like visiting parks, going fishing, or exercising. We asked the governor what the order really means and how it differs from stay-at-home orders already in place in many Texas cities. Here's what he told us.
I wanted to be, if you would, more precise about exactly what it calls for. You are correct when you suggest that it is similar to stay-at-home policies, whether they be in Austin or other jurisdictions. I construe a stay-at-home meaning you cannot leave home. But under the Austin standard, of course, you could leave home to go to the store or to exercise, things like that, as long as you are maintaining distancing practices that don't transmit the coronavirus. So what I did, I was, in my opinion, just more precise, and that is saying that stay at home, with the exception of essential services of running government and allowing you to access things like food that you need to be able to live and survive. Bottom line is it achieves the same concept, and that is unless you have to be outdoors for any reason whatsoever to survive, such as getting groceries, you need to be at home.
The governor's order means that the entire state is under restrictions similar to what was already happening in many Texas cities. It comes after pleas from groups like the Texas Hospital Association and the Texas Nurses Association. The worry is that if Texans don't take more drastic measures, COVID-19 could spread so fast, patients will overwhelm hospitals. And there's still concern about doctors and nurses having enough protective equipment like masks. The need goes beyond hospitals. Small practices are getting hit particularly hard. We found some family doctors buying raincoats to use because they ran out of protective gowns. The governor is promising more medical supplies are on the way. He created a supply chain task force to track down medical gear across the state. This week, our Wes Rappaport spoke to one of the doctors who's on that task force, former state representative John Zerwas.
Can you tell me about the challenges in taking on something like this? I mean, have you done anything like this before? Is there anything that you can compare this to in your personal or your professional life?
Well, but yeah, certainly. I think if you think about, disaster preparedness for hurricanes and things of that nature, there's really a lot of similarities to that, So, Department of State Health Services is incredibly well equipped for this kind of thing. The people who have been working here, they really have processes in place to help address disaster type situations. I don't think any of us have ever been in a situation, though, where the disaster was everywhere. Typically in a hurricane, you can draw resources and personnel and stuff from other places, so that they can come in and help you with things. Similarly, when all the power goes out, you get a flood of linesmen from different cities and different states that are coming in willing to put up the electrical power lines and things like that. Well, this is something that's affecting everything. It's nationwide, it's worldwide. And so from that standpoint, no, I don't think I have, nor anybody else has really experienced something on this magnitude and stuff.
How is this process going so far? I mean, when people donate to the cause, how does that help? Who are you turning to for some of these supplies?
Well, we're turning to everybody for some of these supplies because they're in such great demand. And so we try to follow up on on any leads. We have a significant number of people that have typically always supplied the types of things that we need. That's just part of being in the healthcare and the hospital business. But when you have such a profound demand on these products, then it becomes difficult sometimes to get the amount in that you need in order to safely take care of patients. So, we run down a lot of leads. We work very closely with FEMA and our the whole Texas Division of Emergency Management, Department of Public Safety. Every day there's what they call a unified command meeting, and everybody's reporting what they did in the last 24 hours and what they're going to do in the next 24 hours. And so there's just it's an all hands on deck kind of thing where people bring all their experiences and their expertise together and say, okay, what at the end of all the conversation, what have we not talked about? What do we need to do that we haven't brought up? And it's that kind of cadence and that kind of discipline around the table, that very transparent, direct communication, that is what's going to lead us, I think, into a very good place with it.
Are we making a dent in the shortage of supplies? I mean, we've seen reports from doctors and nurses saying that they're having to stretch out their gear and ration their PPE. I mean, are we seeing strides at this point to make a dent in some of those concerns?
We are, again, we're looking to try to access any type of protective equipment from all reliable sources. That takes a lot of work and effort to do that. Not every lead that we get on supplies is a good lead. I'm sorry to say, but you have to go down that road and check all these things out. And we've got a good, strong team that's working on that. I think we as a state and we as a country are starting to catch up on this, and that we're going to be able to get access to all the supplies that we need.
You were a former budget writer for the state. You've worn a lot of different hats in this process. What do you see as the biggest hurdle that Texas faces looking long term?
Well, I think it's one that obviously all of us recognize, and frankly, the whole world economically has had to shut down in order to deal with this. And so I think we as a state, obviously, we're going to have felt that at some point. How quickly our economy rebounds, I'm not sure. Will it rebound? Absolutely it will. A lot of, I think, the important basics in terms of our economic foundation are still in place. The oil and gas industry, has been impacted, severely by this. There's a lot of other variables that go on with that, and in terms of how quickly that particular part of the market rebounds. But I think absolutely Texas is gonna rebound. It's stronger than ever.
That was Wes Rappaport reporting. Thanks, Wes. Thousands of Texans will need to get back to work before the state's economy can recover. Numbers from the Bureau of Labor Statistics show nearly 276,000 Texans filed for unemployment in the last full week of March. More than 430,000 people in the state have filed claims since the coronavirus shutdowns began. A lot of Texans are still trying to file. The sheer volume of claims swamped the system. Governor Abbott said the Texas Workforce Commission added hundreds of employees to process claims to make sure people get the help they need. Too much supply and free-falling demand push oil prices down. Now thousands of Texas jobs are in danger, and oil industry leaders want the federal government to help. And coming up, mental health care coverage denied. Some of the state's most well-known insurance companies refusing to pay for telehealth therapy until our investigators started asking questions.